My question is going to be directed towards Secretary Davis Jones. Secretary Jones, first and foremost, I want to thank you and your team for the statewide engagement tour that you did in 2023. I was able to participate in a few of those meetings and want to say thank you for bringing folks together all throughout the Commonwealth to talk about issues related to drug and alcohol use. Speaking about issues, Madam Secretary, one of the things I want to talk about is in last year's budget, the department received $17.5 million from the opioid settlement funding allocation from the General Assembly. The department talked about utilizing some of that money specifically in Philadelphia. Many folks across Commonwealth are aware that Philadelphia has a special situation in a particular section of the city. Can you elaborate on the Philadelphia specific initiative and what the department is doing to address that?
Yeah, absolutely. So there was $1 million allocated for a special project in the Kensington area that is really focused on a mobile response, mobile outreach and recovery services for that particular area. I know that that project was slow to perhaps get started, but what we're hearing, I think, as of either by the end of this month or early next month, that unit will be up and running. But what I wanted to share is that, you know, those resources will be made available, and I'm looking a little bit down at Jen to see if she confirmed whether or not we've dispersed any of our, those funds at this point in time. But in addition to that, I will just also say that there's the Kensington Hospital Mobile Wound Care Van that is also in play in Kensington that's being funded through the Single County Authority. We also have funded drop-in and engagement centers for that particular area as well, in addition to an alternative response unit. It's called ARU2, Alternative Response Unit 2, that is connecting people to services after overdose. And then there is also the police-assisted diversion program that's connecting people to treatment. But I'm looking at my sheet here. I mean, we have lots of programs operating, but when it comes to the opioid settlement funds, that $1 million set aside was for that mobile unit that should be up and running either by, we're already at the end of this month, so March of 2024.
Great. I appreciate that. As you know, we do have a new mayor in the city of Philadelphia, and I know that the Kensington situation is a priority for her and her administration. Has there been dialogue or collaboration with the mayor of the city of Philadelphia in regards to addressing that issue specifically? And I'm saying specifically in Kensington. I mean, we recognize that it's throughout the city, but Kensington seems to be a more impacted area. So have there been conversations with the city's leadership to discuss addressing that?
Yeah, we're looking forward to have some conversations with Mayor Parker. We will be reaching out. I know within the past couple of weeks, the Parker administration was here in Harrisburg, and we were trying to connect to have some discussions, but that did not occur. But there is a plan. In fact, I was asked to reach out directly to Mayor Parker to talk about potential next steps in regards to collaborating. So we're going to definitely do that.
Great. I appreciate your comments on that. But the last thing I'll ask is that with the statewide engagement tour, if you can just, not necessarily now, because I know it just ended recently, but my hope is that you can share with the members here, specifically the Human Service Committee, the outcome and the lessons learned from that tour, so that we, in a collaborative fashion, can work with the administration and your department specifically to address the concerns, not just in the city of Philadelphia, but all throughout the Commonwealth as well.
Yeah, so I think that's a perfect segue for me to talk about what's coming next as a result of that work. As you are aware, last year I think we started, trying to think of the time frame. We started, I think it was September, all the way through the end of December. We visited, when it was said and done, we visited 10 counties, 10 SEAs representing 13 counties, sat down with over 200 people at roundtable discussions, visited 19 providers, traveled well over 2,000 miles, collecting outcomes pertaining to key issues that we wanted to hear about. So everything from health equity to talking about the possibility of a treatment slot management system, in addition to talking about data modernization needs that we have in the Commonwealth, and also talking about regulatory reform and how we can communicate better with key stakeholders. We collected over 150 data elements as a result of the Phase 1 tour, and some of the things that were shared with us were already actually mentioned here today. So administrative burdens, right? That was a big call out that we saw as a result, that we heard about as a result of that engagement tour. Workforce issues as it relates to burnout, not being able to hire qualified staff. Of course, the staffing ratio piece was a big topic that we discussed, but everything from workforce development, training opportunities, diversity, equity, and inclusion, addressing language barriers. For example, those that don't have English as their primary language, as a secondary language, the fact that they can't fully engage in higher levels of care like residential treatment, and how might we solve for that particular issue, and is there perhaps any, thinking about innovation and how we might have some kind of device that can translate for them while in group settings. So lots of information was shared, and I'm happy to report that actually this week we will be releasing the results and our response to the Phase 1 of our engagement tour and what's coming next. So we'll highlight those pain points. We'll talk about the actions that we're going to take throughout the year, in addition to talking about our Phase 2 of our engagement tour, because as I said, we only worked with 10 SEAs representing 13 counties. We know we have 67, so we know that there's more work to do, and in fact, people are excited that we're coming out and that we're talking. And so stay tuned for that press release because it will be issued this week.
Great. Thank you very much for that, and Mr. Chairman, thank you very much.